Focus on Health, your weekly dose of health and wealth information on KuTV.
Welcome to Focus on Health, where we educate you on matters health. My name is Bwari Michelle. World Tooth Day is celebrated every year on the 9th of February. And as you can see today, we are here at Bliss Medical Hospital at their dental department. And our topic today is going to be dental hygiene and halitosis. Halitosis is commonly referred to as bad breath, and no wonder we have so many gums and mints in the supermarkets. But this is just a temporary solution. So Dr. is going to be guiding us on the most permanent solutions on dental hygiene and halitosis. But even before we see Dr. on that, here now is a health update. Health. So with me on set is Dr. from Bliss Medical Center, and our topic is dental hygiene and halitosis. Welcome so much, Dr. to Focus on Health.
Thank you.
So Dr. maybe you could even introduce yourself to our viewers before we start.
Okay, I'm Constance Chebet-Cheruiyot. This is Bliss Medical Center. Yeah.
Thank you very much. So Dr. our topic today is dental hygiene and halitosis. Maybe you could guide us through these terms. Halitosis, we've never even heard of such a term for most of us.
It is the practice of maintaining the oral cavity and the mouth clean.
Okay. What about halitosis?
Halitosis is the bad breath.
Okay. Yeah. Thank you very much, Dr. So Dr. now here we are at the dental department. We have a patient. Maybe you could guide us to, knowing what are the first steps that you take when the patient comes to you and, you have to now diagnose.
Okay. Now comes my patient. She's called, your name please? Okay, well, the first thing we normally do to our dental patient, she comes in, we do the consultation. Now the oral examination, we need to examine what the patient is feeling, then we give now the final diagnosis. Yeah.
Very informative, Dr. Maybe you could head on to that.
Okay. Hi, Nancy.
Hi.
I'm Constance. Welcome to dental. What is the problem today?
I'm here for a normal checkup.
How do you feel?
I feel pain when I take some drinks.
Procedure.
Yes.
Okay, maybe you could tell us what is the importance of that particular procedure?
The importance of doing the checkup before you proceed with any service you give to the patient, we do the oral examination.
Okay.
Now we check the patient. If the patient has any problem, now this is the right time. We'll tell the patient we need to do this and this.
Okay.
Yeah.
And Dr. What are the consequences of maybe not going through, with this procedure, regular checkups like you said?
Okay, there are some many causes which may lead to not coming for dental checkup. Either you can get some cavities, you get some bad breath, you have some missing teeth, the retained roots, you end up losing many teeth.
Okay.
Now you become a dentulous.
So now actually that you've mentioned bad breath, you've actually taken us actually to our topic today, which is dental hygiene. Maybe you could tell us, what are some of the practices that you would encourage us, even our patient here, to do in order to maintain dental hygiene?
Okay, the practices we normally advise the patient to do is to maintain good oral hygiene.
Okay.
This is by brushing well. You take 5 minutes brushing. Now after that, there is a mouthwash. You need to rinse your mouth with it. Then brushing, you need to brush twice in a day,
Okay.
especially for those who normally go for work. You brush in the morning after meals, then in the evening before you sleep, you brush well.
Okay.
Yeah. Then after brushing, there is something called flossing. Flossing, that is a type of a thread. We normally remove food or any particles which during brushing it can't come out. So you use now the floss so that you can remove all the food debris in the mouth.
Okay.
Yeah.
And actually you've mentioned brushing twice a day, and some people say that actually brushing at night is the most effective. Why is that?
Yeah, normally we advise patients to brush during the night before they sleep, in that the bacteria normally work during the night. Yes.
Okay.
Yeah.
And what exactly happens, after maybe the bacteria works during the night?
Oh, normally we have the sugars which are in the mouth, they break into acid. The bacteria break the sugars which are found in the mouth, then they become acidity.
Okay. So maybe even for a patient who said maybe has a few cavities, you can recommend maybe like brushing to avoid, cavities, existing.
Already when you have a cavity, you need to come, we do something called dental filling.
Oh, okay.
Yes. If at all you have a cavity, then you brush well. Okay, the extent of the cavity won't prolong. It will stay like that, but we need to do some fillings. We restore the tooth. Yeah.
And how often should one replace their toothbrush?
After 3 months. Now again, when you have some cold or a flu, you need to change your brush. Yes.
Okay. Dr. we have maybe various types of foods that you should avoid and even those that you should eat. So maybe you could guide us on which types of food will, help you improve your dental hygiene, and even those that will make it, now become worse.
We have the dietary habits. For a patient, we need to advise the patient to eat less sugary food. Yes. Like if at all a patient, for kids, we normally advise the kids not to take anything sugary, or if at all they take the sugary things, they need to brush immediately. Now for adults, we need to take more of carbohydrates. We leave the sugary things like biscuits, sweets. But if at all you are somebody who likes snacking a lot, we have the sugar-free gums in the supermarkets. You can use that. That is advisable.
So, Doctor, you've told us about the importance of brushing our teeth. Tell us about the tongue. Why is it important to brush our tongue?
The importance of brushing the tongue, this will help us to avoid the bad breath and even getting the tonsillitis. Yes.
Okay, so Dr. we have babies, and you can't really brush your baby's teeth. So what can you do to ensure that even the dental hygiene is checked?
We normally recommend the parents of the babies to assist the babies on how to brush. Like if the baby is very young, 0 to 2 years, they can take something clean, they wipe for the babies. If at all the baby takes a lot of medication, after taking the medication, the baby is allowed, the mother or the guardian of the baby needs to wipe the teeth of the baby so that the mouth of the baby remains clean.
Okay.
Yeah.
Daktari, traditionally, we've seen even our grandmas, maybe they, instead of using a toothbrush, they use maybe a stick and they have maybe salt and they don't use toothpaste. Is that really effective, or does it even help maintain dental hygiene?
It's effective in that normally when you backdate our grandparents, or even our parents at home, they normally use that. But when you do some survey, they don't have the cavities. That is recommended. If at all you can get it, you brush well with it, no problem. There's no harm.
Daktari, maybe now you could guide us through measures that, maybe are preventive to ensure that you don't get diseases and also to improve your dental hygiene.
First, you need to come for a checkup. Then after checkup, you need to brush well. You check the food we normally take. Yeah.
Let's talk about prevention. How do you prevent, these diseases arising from maybe negligence of dental hygiene?
Prevent eating habits like sugary things, snacking a lot. You recommend it to the patient. That is very alarming to them.
So Daktari, let's say you've practiced all these, good measures that you've said. Is it possible to actually still get these diseases afterwards?
Yeah, you can. If at all we restore everything, we do all the services you have in your mouth, but you don't stick on good brushing, the problem will come back to you. That I cannot guarantee you that everything will be well to you, but you need to be coming for checkups at least even 6 months after every 6 months. Yeah.
So maybe Daktari, you could hold on to that thought. We're going to take a slight commercial break. Do not move a muscle. I'm going to leave you with the Did You Know segment. Continue following us on our social media platforms on Instagram, Facebook, and also on YouTube at Focus on Health. Leave any questions, suggestions, and comments.